ZOLGENSMA is a prescription gene therapy used to treat children less than 2 years old with spinal muscular atrophy, SMA. ZOLGENSMA is given as a one-time infusion into the vein. ZOLGENSMA was not evaluated in patients with advanced SMA. ZOLGENSMA can increase liver enzyme levels and cause acute serious liver injury or acute liver failure, which could result in death. Please continue watching for additional important safety information.
We learned of Lucy's diagnosis through the newborn screening. At 11 days old, we have received a call from the state that let us know about Lucy's diagnosis. When we initially received the call, we had a lot of questions and a lot of doubt went through our mind because we just never heard of it before. Once we got that call, we started looking into it and just started trying to get our head around of what exactly SMA was and how it was going to impact Lucy and the rest of her life. Within that appointment, what we learned was the urgency behind getting treatment for SMA as soon as possible. Within that first appointment, we understood more about the disease and how time was really of the essence. After meeting with neurology, it was basically a 24-hour decision that we made to pursue ZOLGENSMA. We decided to treat Lucy with ZOLGENSMA after reading that it was a one-time infusion and that it was actually freezing the progression. What we did that next day was make the appointment to go back to the neurologist's office and get the blood work started.
Patients will receive an oral corticosteroid and will need blood tests before and after infusion with ZOLGENSMA.
After receiving treatment with ZOLGENSMA after our infusion day, what we then had to do was do weekly follow-ups with the doctor. What this included was taking Lucy for weekly blood work at the hospital and then still meeting with the neurologist. With the continuous labs and appointments with the neurologist, it gave us a sense of comfort because then we knew that Lucy was being monitored post-infusion just to make sure that everything was still on track with Lucy. Some of the initial milestones for Lucy were the very small ones of just watching, can she kick her legs? Can she grab at her toys? And getting like those first 5 motor skills. And then from there, it was okay, is she sitting assisted? Is she sitting unassisted? All the way through. We saw that within the first year to maybe 15 months, we saw all those milestones. Last year, it was Lucy's preschool graduation, and you're in a room full of parents. I'm getting teary-eyed because I'm like, yes, preschool graduation is such a big thing, but sitting there, knowing that originally you received a diagnosis that maybe your child wouldn't see the age of 2 without treatment was a whole different feeling when you were sitting in that room because you're like, here she is now at the age of 4 and graduating preschool. Lucy today is 5 years old and she absolutely is a vibrant little girl. She's doing things that we never imagined that she would do when we first heard of her treatment. Today she is running around. She just started the training team for gymnastics.
Results and outcomes vary among children based on several factors, including how far their SMA symptoms progressed prior to receiving treatment.
For Lucy, Lucy literally loves to do everything. Gymnastics by far is probably her number 1. Lucy made the training team for gymnastics, so that's definitely where Lucy puts most of her time and energy. For a 5-year-old gymnastics, she's doing cartwheels, she's starting to do a bar routine, she's starting to work on the beam, she's finalizing beyond cartwheels, doing tumbling, and back bends is actually the latest thing that she's been working on. Really trying to work with me on getting that. I'm so excited just to see Lucy just keep pushing the limits, really. For me, my expectation was just for Lucy to be happy. And I continue to see her being happy and just growing. And, exceeding my expectations, exceeding her expectations, and just finding the things that she loves to do and just, pursue those. Watching Lucy meet these milestones and achieve these things to me is beyond anything I ever would have imagined. She just absolutely loves to do things that a 5-year-old loves to do. She just loves to live life to her fullest.
Ask your child's doctor about the one-time infusion with ZOLGENSMA. Please continue watching for indication and important safety information. Indication. What is ZOLGENSMA? ZOLGENSMA is a prescription gene therapy used to treat children less than 2 years old with spinal muscular atrophy, SMA. ZOLGENSMA is given as a one-time infusion into a vein. ZOLGENSMA was not evaluated in patients with advanced SMA. Important safety information. What is the most important information I should know about ZOLGENSMA? ZOLGENSMA can increase liver enzyme levels and cause acute serious liver injury or acute liver failure, which could result in death. Patients will receive an oral corticosteroid before and after infusion with ZOLGENSMA and will undergo regular blood tests to monitor liver function. Contact the patient's doctor immediately if the patient's skin and/or whites of the eyes appear yellowish, if the patient misses a dose of corticosteroid or vomits it up, or if the patient experiences a decrease in alertness. What should I watch for before, during, and after infusion with ZOLGENSMA? Infections before or after ZOLGENSMA infusion can lead to more serious complications. Caregivers and close contacts with the patient should follow infection prevention procedures. Contact the patient's doctor immediately if the patient experiences any signs of a possible infection, such as coughing, wheezing, sneezing, runny nose, sore throat, or fever. Decreased platelet counts could occur following infusion with ZOLGENSMA. Seek immediate medical attention if the patient experiences unexpected bleeding or bruising. Thrombotic microangiopathy, TMA, has been reported to generally occur within the first 2 weeks after ZOLGENSMA infusion. Seek immediate medical attention if the patient experiences any signs or symptoms of TMA, such as unexpected bruising or bleeding, seizures, or decreased urine output. There's a theoretical risk of tumor development with gene therapies such as ZOLGENSMA. Contact the patient's doctor and Novartis Gene Therapies, Inc. at 1-833-828-3947 if a tumor develops. Infusion-related reactions may occur during and after ZOLGENSMA infusion. Seek immediate medical evaluation if signs and symptoms of infusion-related reaction occur, which may include rash, hives, vomiting, shortness of breath, respiratory symptoms, and/or changes in heart rate and blood pressure. What do I need to know about vaccinations and ZOLGENSMA? Talk with the patient's doctor to decide if adjustments to the vaccination schedule are needed to accommodate treatment with a corticosteroid. Protection against influenza and respiratory syncytial virus, RSV, is recommended, and vaccination status should be up to date prior to ZOLGENSMA administration. Please consult the patient's doctor. Do I need to take precautions with the patient's bodily waste? Temporarily, small amounts of ZOLGENSMA may be found in the patient's stool. Use good hand hygiene when coming into direct contact with patient body waste for 1 month after infusion with ZOLGENSMA. Disposable diapers should be sealed in disposable trash bags and thrown out with regular trash. What are the possible or likely side effects of ZOLGENSMA? The most common side effects that occurred in patients treated with ZOLGENSMA were elevated liver enzymes and vomiting. The safety information provided here is not comprehensive. Talk to the patient's doctor about any side effects that bother the patient or that don't go away. You are encouraged to report suspected side effects by contacting the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch or Novartis Gene Therapies, Inc. at 1-833-828-3947. Please see the full prescribing information.